Yeah, we are live. Hi
Yes.
everyone. Today we have
Hello.
special guest. Yeah, last week, right, due to some technical problems, so we actually wanted to relive our topics for last week. Yeah, so today is about the knee pain part 4, right? It's about pain
Yes.
at the side. So today, Ben, we're gonna share about the physio side, and today we have special guests from one TCM, Miss Ling. Hi, Ling. Thanks for joining us.
Again, see you again. Yeah, I think if everyone noticed, Eileen came here before.
Yes.
Yes,
Yes.
yes.
Last time she talked about the core, right? About the low back
Yes.
pain. Yeah.
Okay.
Yeah.
Okay.
So, yep, you're already here already. Just +1 and share it to your friends because maybe last week you have some technical problems. So tell them we are still having this topic today. Yep. Hurry up,
Yep.
tag your friends. And we're giving out free physio session today also. Okay?
Yep.
Okay. So before we start, always there's a disclaimer, okay? So this presentation is just for the content, just for educational purpose. And BENPHYSIO or one TCM is not responsible for any injury, damages caused because of this information presented. Okay? So this content is not intended to substitute for professional medical advice. So always seek for your qualified health provider or your qualified physiotherapist. Okay? Okay, so about aging, right? Everyone will grow old, right? But what we wanted to achieve is what WHO define as a healthy aging. So we need to have like optimal functional, right? When we grow old. Yeah, it will cause a lot, there will be a lot of stiffness, there will be pain because of this generation. But of course, what we wanted to do is to maximize that functional capabilities when we grow old. Right, Mr. Ben?
Yes. As long as you are
Yep.
mobile and able to move. That's why a lot of
Yes.
people say right nowadays if they want to travel, they don't want to wait until old age already. You know why?
Because you cannot
Because
move that
when old
time.
age, yes, I have money already, but I cannot walk already. Yeah, all right. So nowadays people tend to another way now. While I got money, while I can walk, I go for travel first. All right, but we always emphasize we can age with healthily and mobile. Yes,
There's always ways to maximize it.
yes, yes. Yeah, that's the word. Maximize it, optimize
Yes.
it.
Optimize it. Yep.
Yes.
So yeah, we are in our fourth topic of the degeneration of knee pain. So it's called as a Pes Anserinius, as we wanted to tackle that muscle at the side, in medial side, inner side of the thigh, your knee.
Yes.
Yep.
Yes.
And also from one TCM side, you see what is the causes and symptoms and how to treat from one TCM side,
Yes.
right? Healing.
Yes.
Yes.
Yes. Okay. So there's always a lot of myths about the knee pain. So before we go through our usually common myths of all this pain, knee pain, so just want to ask Miss Yiling, so from one TCM side, what is the causes and symptoms towards the knee pain from TCM perspective?
Okay. Yeah. So you can move on to next slide. I can do a detailed explanation. All right. So okay, from TCM's view, actually TCM has always been one of the popular alternatives for pain-related issues, and has been shown to exert therapeutic effect, especially on pain, knee pain or neck pain or shoulder pain. So today we'll be talking about knee pain. Okay, so patients who have chronic knee pain often complain of knee pain, definitely, joint stiffness, and impaired function of the knee. Aside from that, in the clinical setting, patients will also mention that the knee pain is usually worse with cold or alleviated by warmth. And oftentimes, they will also add that there is sourness, or cold sensation at the knee. So these are the common symptoms that we heard from our patients. Okay, so moving on to the next slide. by using the symptoms and along with TCM's pulse and tongue diagnosis. So TCM found out the common causes for chronic knee pain are kidney deficiency, blood stagnation, or the retention of cold damp. So for kidney deficiency, it's more common among the elderly and often comes with knee weakness and fatigue. So next, for blood stagnation, which means poor blood circulation, and this can further causes poor circulation around the knee. And then lastly is the retention of cold damp. In Chinese, we call this 寒湿. So all of these causes can happen either individually or simultaneously, where in some severe cases, we can also see 3 of these causes happen together at the same time. So, yep, these are the common causes from TCM's perspective.
So can I just ask one question? If let's say those knee pain, right, especially in the cold weather, so that is because of the subhay, is it the cold damp retention?
Yes. That is under the category of cold damp subhay, especially for those who stay in a dampness area for a long time, or they tend to, we said it, swimming a lot, and then if they shower at a very late time, and this will cause the dampness to accumulate inside their body.
Okay, right. So thanks, Ling, for sharing. Yep. So we're gonna talk about the common myths that we always mention about knee pain lah. So people always say, exercise matter because some exercise regularly, yet they have knee pain, and then some I do not do much exercise, then I also knee pain. How Mr. Ben?
So answer is muscle is the answer. Yeah, muscle stiffness is the answer. Okay. So I mean, this one we have answered it. I think during our first life. Yeah. Second common myth.
Body
weight. So same thing. I'm overweight. Yeah, I'm overweight. I got knee pain. But some very thinner than Ling and Shu Hui, still got knee pain. So why? Okay. About a muscle, okay, muscle stiffness.
Yep.
All right. Now, third common myth.
Age matter.
So some people say, "Oh, I'm old. I got knee pain." So everyone makes sense. So for everyone, they thought it's normal. But some young people, I'm in 30s or my early 20s. How come I got knee pain? So do you think it's the age matters? So again, it's your muscle stiffness.
Okay.
Yes. Okay, now today we talk about fourth common myth. Okay, is total replacement is the only option that I have today. Okay, now come to 2020. So everyone have a thought that, my knee pain, eventually I have to go for knee replacement. Okay, so is that what we have now today for every human? So honestly, I totally disagree with it. Okay, I believe again, okay, with physio's helps, okay, with your knowledge that we know, we should be able to preserve our knee until our last day. All right, so the answer is no. Okay, total knee replacement is not our only option. Okay, and last common myth.
Glucosamine.
Does glucosamine works? So my answer is yes, it does. Okay, but a lot of people say, how come I took for the first few months, it works, but after that, it doesn't have the effect anymore. Reason very simple. Glucosamine has managed to help you to replenish all whatever is missing, whatever is wear off. But do you find out the root cause that make wear off of your cartilage, of your degeneration? All right, you understand what I mean? I repeat. So glucosamine works, okay, in regenerate the entire cartilage, okay, all the things, okay, replenish all the cartilage gel in the knee. But do you ever find out what has caused the cartilage to wear off? This is why we are here today. All right, so therefore, glucosamine works. All right, it's just that at the end, you still need to do something. We cannot rely on glucosamine only. Yeah.
Yep.
Okay. So that is the answer. So again, what caused the wear and tear? What caused the cartilage to wear off so fast? Muscle stiffness. Of course, there are some muscle weakness that we need. Okay, but muscle stiffness is still the priority. Okay, the primary cause. All right. So as a physio, we always tell our clients that, or tell our patients that, yes, I need to know where is your pain. Is it the front? Is it the behind? Is it below your cap or wherever? And what movement caused the pain? All right. So therefore, our first life is going upstairs pain. The second life is coming downstairs pain. And the previous life was
Sudden pain.
Yeah, yes. And today's life is talk about inner knee pain. It's a little bit very rare, but there are some people who also have it. All right, but leave it untreated. All right. And thirdly, we will tell people what is the mechanism, why there is a pain. And lastly, what are the structure involved. All right. You need to know what are the structures. Then you need to know. Then only you know how to fix it. Okay. So next. So today we're going to talk about something called Pes Anserinius. Okay. Or in another way, you can call it Pes Anserinius. Pace. All right. Pes Anserinius. So what I need to do is just remember the name PES Pace. Okay. This is a name called PES Pace. All right. So basically, where is Pace? Okay, Pace falls at the middle side, at the inner side of our knee. Okay, at the inner side of our knee. All right, so, okay, now if can turn the video to see me.
Okay. Anatomy time.
Yes, anatomy time. Very simple one. All right, so now if you look at this knee, right? So this is our outer bone. Okay, this is our outer bone. Where is our pace? So our pace is just around here, the blue color one. This is where our pace is. All right, this is your kneecap, okay, whereby you can bend knee, okay? And where is your pace? Inner side of your knee. This is my right knee, okay? So inner side of your knee is more all the inner side, okay? Now go back to our slides. Okay, so inner side of the knee, next. Okay, so why this pace is so special? All right, now according to anatomy, now this is why I extract it from anatomy book right now. Look at this Pes Anserinius, like, or you call it Pes Anserinius also can. So it consists of 3 important muscles. Okay, it consists of 3 important muscles, which a lot of practitioners will miss it. All right. Okay, now again, these 3 important muscles, don't remember it, don't memorize it, because it's not going to come as a question today. All right, what you need to know is there are 3 muscles blends into this Pes Anserinius. All right, now simple one. Now next, now muscle number 1, it falls as your inner thigh muscle. Okay, inner thigh muscle, we call it gracilis, inner thigh. All right, it's just at the inner thigh. Now muscle number 2, 3 muscles, this is how we mentioned. Now number 1, inner thigh muscle. Now number 2, we call it cross leg muscle. Okay, we call it a cross leg muscle. Okay, and number 3, we call it your hamstring muscle. Okay, hamstring muscle. These 3 muscles. All right, so most important you need to know is this Pes Anserinius, why it is so important, because there are 3 muscles blends into this point. That's all. All right, so next, how to fix it. Okay, so next is how we're going to okay, so how to explain it, why there is a pain. All right, one slide before.
Yeah.
Okay, it is because, so the pain area normally is at the inner side of the knee, and then it will be one point, very, very painful. All right, and it's very, very stiff to move, especially in the morning. These are the symptoms, and you feel like a bit warm, feel like a bit feverish. All right in the inner side of your thigh, of your knee. All right, this is where the Pes Anserinius is. Explanation is always because of inflammation. So therefore, this kind of case, right, normally if you take glucosamine, if you take anti-inflammatory, it will work much better. Okay, because it's inflammation. All right, so next. Okay, so same thing. Immediately, suddenly wake up in the morning, you feel a bit stiff in the knee. Shall I come and see physio? The answer is yes. Okay, why? Your physio will do something to reduce the inflammation. For example, we give you ice pack. Okay, we teach you how to wear a knee guard. What kind of knee guard is suitable? Okay, the knee guard as what you see in the first photo on the left. Okay, it's a kind of compression knee guard. All right, ultrasound. We may give you some ultrasound to relieve your inflammation. Solomeric. All right, or TCM also do something. Can do something for our this inflammation. All right, or worst come to worst, we may advise you for some medication. Okay, and this is the reason why you need to come and see us during the day 1 of your inflammation. Don't wait. Okay, don't wait, because this feverish feeling will get more and more after the day. Okay, so next. Okay, so what can I do at home? Okay, so what can I do at home? So before TCM teach us, I teach you first. Okay, so first thing, and we need a coffee table. Okay, need a coffee table. So now normally what do we do with a coffee table?
Jump
We put our
cha.
leg on it. 飲茶 I mean that's where we put a coffee lah. Of course, so put our leg on it lah. Okay, now I teach you all exercise whereby you can put your leg on the coffee table. Okay, first prepare a coffee table. Now second, okay, next, put your leg on the table. Okay, put your leg on the table like the girl on the chair. Okay, you can put your leg on the table. Then what you do? Bend forward. Okay, bend forward as if you're trying to grab your toes. Okay, so this is where you try to stretch your hamstring. Just how we say, there are three muscles blends into the pace. Okay, so first muscles that we're going to stretch is hamstring. So you put your leg on the coffee table and then you just bend forward as if you're trying to grab the toes. Okay, now our stretching always, as usual, we hold for 10 to 20 seconds. 10 to 20 seconds. Okay, you can be 17 seconds, 18 seconds, up to you, but 10 to 20 seconds stretching. Okay,
Also,
so
to
next,
maximize the lengthening, also we should keep the knee straight, is it?
yeah, yes, you have to keep the knee straight. Keep the knee straight and then slowly bend forward. Okay, and then hold for 10 to 20 seconds. Okay, now second one, same thing. Still leave your legs on the coffee table. Okay, so just now you bend as if you're trying to grab your toes, Now, as if you want to stretch your inner thigh, now you have to bend 90 degrees away from your feet. Okay, like the photo on the right hand side. All right, so your feet is still on the coffee table. Okay, now you bend 90 degrees away from your feet, and you should feel the stretch pulling, okay, around your inner thigh. Yeah. Okay, so same thing, hold it for 15 to 20 seconds, 10 to 20 seconds also can. Yes. Okay.
Okay.
Okay. Yep. So this is the inner thigh muscle. Now, some people say, "Oh, can I do this kind of
stretch?
Butterfly stretch?" Yes. Now, put it this way: the muscles that blends into Pes Anserinius is we call it a long muscle. Now, this butterfly stretch is a short muscle stretch. So yes, you have the same feeling, but you are not stretching the same muscles. So if you have to stretch for the Pes Anserinius, just now the previous way will be the more suitable way. Okay.
So just remember, every stretching have to straighten the leg.
Yes, and your feet is on your coffee table.
Okay.
So if you are stretching a butterfly stretch, your feet cannot be on coffee table. So salah. Very simple. Okay. And next. Okay, now another third muscle we call it cross leg muscle. Okay, so this one, okay, as a photo is you are trying to stretch your right hip muscle.
Hip. Okay.
Yeah, the right hip, which is the cross muscle. So what you do is just try to position yourself into that position. Now this photo, you're trying to stretch your right muscle. Yeah, put your right leg into this upward position. That's where you're going to stretch your hip muscles. Okay. Same thing. Hold it for 10 to 20 seconds. Yes. Okay. So three muscles, three ways of stretching. Okay. Now, some people, can I use foam roller to stretch these three muscles? We have my inner thigh muscles, my hamstring muscle. Answer is yes. Okay. So here I will also attach two photos for your reference. All right. If you want to stretch, if you want to foam roll your hamstring, yes, you can do like the guy did. Okay. If you want to stretch your inner thigh muscles, you can do like what the lady did. Okay. Yeah. So these are some reference photo for you to imitate or learn from them. All right, most important is today what we're trying to teach you is there is a hidden inner knee pain that a lot of people ignored or a lot of people did not think about it, okay, which we call it Pes Anserinius. All right, and it consists of these three muscles, and today we are only teaching you how to stretch these three muscles. Okay, so I think that's all from my side.
Yep. Thank you, Aben, for the sharing from physio side. Yes. So we wanted to ask Miss Ling from TCM side, because TCM side also in treatment wise also very useful for this kind of knee pain, right? So how would you treat this kind of problem? How does it help?
Okay. So TCM, we have a few approaches to treating this problem. So it can be with herbal medicine, acupuncture, tuina, or diet therapy. So acupuncture will usually be the main treatment option. It can help to relieve tightness and stiffness of the muscle. It will be the overall stiffness, and then also reduce inflammation like Ben mentioned earlier. So the frequency of treatment needed is usually once or twice a week. But of course, this is subjective to the severity of the case. And many clinical studies support acupuncture's ability to relieve osteoarthritis pain, particularly in the knee. So, and we also got real life feedbacks from our patients using herbs, acupuncture together with physio, that they felt much relief of the knee tightness, reduce in pain, and also improve in the range of motion after the treatment.
So usually, like, how long does it take? Like, or it depends on.
You mean how many sessions?
Yeah.
It depends on persons. Some they may have more severe conditions, so they'll need longer time. Some like acute pain, definitely they'll need shorter time. For example, 3 to 5 sessions.
Oh, okay.
Okay, so yeah, next slide. How to prevent? We always say that prevention is better than cure. So are you able to prevent? And the answer is yes. Okay, always make sure you are keeping a healthy body weight, and also try to be active every day. And as you're active, be very careful to keep away from joint injuries. And last but not least, pay attention to the pain. Yes, I repeat, listen to your aches and pain, as they are the indicators or warning signals that are giving you a hint before any part of your engine breaks down, like the pain, knee pain.
That's why I come and see physio and TCM when you're in need.
Yes, the combination.
Yes. So the early you come, actually you settle the problem earlier. Yeah. So if you come in later, you have to settle more problems. This is what I will explain.
Yes.
When you come early, you don't need to deal with your inflammation because there is no inflammation yet. All right, you just need to deal with some muscle stiffness, and then you can discharge. But when you come later, you already come with a lot of inflammation, a lot of swelling.
A lot of wear
So most of the time,
already.
So most of the time,
and it takes
the
longer
treatment
time.
itself, the treatment itself is take longer because I need to heal the inflammation and healing. And for everyone's knowledge, for your knowledge also is inflammation takes about 10 to 14 days to get healed, provided that if you treat them properly at the root cause. Okay, I repeat, inflammation takes about 10 to 14 days. So like what Ling said, for some people it can be longer because we mentioned a word called chronic. So when there is a chronic, that means what, you have been having the pain for more than about 3 to 6 months. So that means your inflammation is a lot more. So we don't expect within 10 to 14 sessions already to get rid of this inflammation. It may take longer. So therefore, sometimes we also want to collaborate with some medication, Western medication, anti-inflammatory. No choice. I know getting more and more people, right? They have start to have health conscious. They don't want to take anti-inflammatory anymore, right? They will say, "Hey, I don't want to take anti-inflammatory, can or not? Is cyber, can or not?" I say, "Too bad already. Too inflamed. All right, you need anti-inflammatory. Otherwise, you're wasting. I mean, you take longer time. So why you want to take longer time? Just take 1 or 2 lah, okay? According to your pharmacist's prescription." So this is our job as well, to advise you on what kind of medication, what kind of group of medication to take. Yep.
Yep. So also for
Okay.
TCM side, also we have something for 消肿, right? 消炎.
Yes, it's
Anti-inflammation
on the
medication.
next slide.
Yep. Okay.
Yeah, okay. So this is the home remedy. Usually we will advise our patients, other than the herbs we prescribe for them, they can also incorporate some herbs into their diet. As we have mentioned earlier, there are many causes to knee pain. So for the causes that you're having is the damp cold, so you can try to add in ginger and turmeric, which has the warming properties into your diet, as this will remove the cold from your knees. And also turmeric has anti-inflammatory properties as well. Okay, And for kidney deficiency and blood stagnation causes, which is pretty complicated, it is advisable to pay us a visit so that we can properly and holistically address your problems after the full examination and assessment.
So you need to like overall consult, assess first, then only you know what is the best remedies for them.
Yes. I mean, same to physio. We must assess you first before we prescribe you anything. Yes. Okay. And we always say in the medical line, right? No one of the patient is the same. Everyone is different. Even though you have the same pain at the same area, at the same movement, you are still different from the rest. Yeah. So again, none of the treatment, there is no one treatment works for everyone. If you see someone is practicing or treating you with only one style of treatment, that one is we call it Gong Wu. that one is Gong Wu treatment already. Okay. So must come and let us assess first. Yes. Okay.
Yes.
Yeah, before ending this, right, you just want to ask Flo the comment. Any question, take this opportunity to ask our Miss Ling from TCM side, also from Ben.
Yes. So I would say is okay lah. This topic may not be the very famous topic type because a lot of people don't know that this muscle do exist. Pes Anserinius. You may know it's Pes Anserinius. We know. Okay. But we may not know Pes Anserinius. But if you have someone who have inner knee pain and have been taking glucosamine injection, but yet is still having the pain, yes, you can come for this. Okay, you can come to let us assess that if you are having this Pes Anserinius. Yeah, okay, because it's a very often muscles group that people miss it a lot. Okay, we have seen many.
Sometimes it also can be combination of other muscles.
Yes, it can be combo. Yeah, going upstairs also got pain morning feverish come downstairs also got pain then we have to assess and we have to evaluate you.
Okay, so now the exciting part, because we want to give out the gift already. Yes. So yes, what is the question for your viewers?
Okay, so the question is very simple. Okay, so what is the muscle's name? Okay, no, sorry. What is the structure name that we mentioned today? Okay, that is worth for you to come for physio. Okay, what is the structure of the knee? Okay, that is worth for you to come for a physio. Okay, to have an assessment. Okay, to be done. Okay, so what is the name? Not the tree one. Okay, just the group name will do. Okay. Yeah, so that's the answer for today. So you may not know what is the spelling. Now, Shuhui is giving you the hint. Yeah, Shuhui is showing you the hint.
Something like Pes Anserinius?
Yeah, but not Pes Anserinius. Pes Anserinius.
Must spell correctly,
yes. So we will have 2 minutes from now. 2 minutes from now. 30 minutes, our life. Okay?
Yeah, those who comment already. But you have to tag 3 friends.
Yes, tag 3 friends and answer. Okay, I like the answer pace. Just nice. That's the purpose we are having this kind of life. Okay, you immediately you remember pace. So last week we got pop.
And we have quartz. We have latte.
Yes. Okay, we make everyone to understand.
Yep. Any question for our physiotherapist, Mr. Ben, and Chinese physician Ling? Take this opportunity to ask.
All right. So we repeat. Glucosamine do works. Okay, that's why a lot of research has found that it works. Okay, but it's just that glucosamine treats your symptoms of pain, symptoms of cartilage wear off. Okay, but at the end you need to know what cause wear off. Okay, this is why I always tell people, you need to know what is the root cause.
Oh yeah, Yiling, I have one question can I ask you? Is there like a acupuncture point for OA?
Yes, actually. Okay. Yes. There's actually quite a few numbers of points around the knee, either at the front or from the back. So
Also depends on their condition.
I'm thinking how to say it. Can you show me the previous slide
Previous this one?
of this? Okay, so okay. So below the kneecap, there's actually 2 points, which is more targeting for knee or osteoarthritis, and then we call it 足鼻穴.
Just below the
It's,
kneecap.
Yes, just below the kneecap. One on the left, one on the right.
Oh, okay.
Yeah.
Right. In Western, below the kneecap, we call it there is a 2 eyeballs.
Yeah.
Eyeballs.
That place.
Yeah.
Yes, that
Yeah.
place.
Oh.
Okay. If you 你放我大特写 Yeah, 2 eyeballs around here. We call it or 2 2 eyeballs around here. That one my hand.
Yes, that place.
Okay, these 2, right? Everyone will have 2 dimples there one anyway. Yeah.
Also the dimple.
Yeah, a dimple, 2 eyeballs. Or we call it eagle eye. Yeah, we call it eagle eye. Yes. Hey, wait, someone is commenting. I got knee pain only happens when I try to get up from kneeling. Very sharp pain. So I try to push up with my hands. Okay, Alan Leong. Okay, go back to our first life quadriceps. Okay, quads. That is your problem. All right. If your pain is when you get up from the kneeling, that is your problem. Okay. If your pain is going down to kneeling, then that is not your problem. Okay. But if your pain is due to have difficulty to get up from kneeling, that's your problem. The first slide, okay, about quadriceps, the front thigh muscle. Yeah, you can check it out on that, Alan Leong. Okay. So next Saturday, we're going to talk about knee cartilage. All right. We are trying to answer everyone's question about knee cartilage. Next Saturday, we're going to talk about knee cartilage, how the wear off happened. All right. Then we will change topic already. So whoever interested in the knee one, okay, stay on next Saturday. Last topic about knee. And we will have Growway to come in. A dietitian to come in. Okay. So
yep. So
thank you.
Thank you, Aben. Thank you, Miss Ling.
Thank you both Ling Lui. Bye bye Ling. Thank you Shu Hui.
Thank you.
Bye bye.
Bye bye.